Welcome to this first aid training video. In this course, we will cover a wide range of emergency situations and teach you the skills needed to provide effective first aid. We will start by discussing the importance of conducting a first aid assessment in any emergency situation. Then, we will move on to some of the most serious and potentially life-threatening situations, including severe, life-threatening external bleeding, shock, and amputations. We will also cover minor wounds such as tooth injuries and bleeding from the nose, as well as more serious injuries like impaled objects and eye injuries. Additionally, we will teach you how to handle internal bleeding, open chest and abdominal injuries, and head, neck, or spinal injuries. We will also discuss how to recognize and respond to various medical emergencies such as concussions, burns, altered mental status, poisoning, asthma, relief of choking, severe allergic reactions, heart attacks, and more. By the end of this training, you will have a solid foundation in first aid and will be better prepared to handle any emergency situation that may arise. Welcome to this section on first aid assessments. In this training, we will cover the essential steps involved in conducting a thorough and effective assessment of an injured person. The first step in any first aid assessment is to ensure that the scene is safe for both the injured person and the responder. Once the area is secure, you can begin the primary survey, which involves checking for any immediate life-threatening conditions. The primary survey consists of 4 main steps: checking the person's responsiveness, ensuring their airway is clear, checking their breathing, and assessing their circulation. During this process, you will check for any obvious signs of injury, such as severe bleeding or fractures. After the primary survey, you will move on to the secondary survey, which is a more detailed assessment of the person's injuries. This involves a head-to-toe examination, looking for any other injuries or medical conditions that may not have been immediately obvious. Throughout the assessment, it is crucial to continuously monitor the person's vital signs, including their breathing, pulse, and level of consciousness. Any changes in these signs can indicate a worsening condition and the need for immediate action. In summary, a first aid assessment is the critical first step in providing effective emergency care. By following the primary and secondary survey processes and continuously monitoring the person's vital signs, you can quickly and accurately evaluate their injuries or illnesses and determine the appropriate course of action. Welcome to this section on severe, life-threatening external bleeding. In this training, we will cover the essential steps involved in providing effective first aid care for someone who is experiencing severe bleeding. Severe bleeding can be a life-threatening condition, and it is crucial to act quickly to control the bleeding and prevent further injury or harm. The first step is to assess the severity of the bleeding and determine if it is life-threatening. If the bleeding is severe and life-threatening, the first action is to apply direct pressure to the wound. Use a clean cloth or gauze pad to press down firmly on the wound and maintain pressure until help arrives. If the cloth or gauze becomes soaked with blood, do not remove it. Instead, add more on top and continue to apply pressure. If the bleeding does not stop after several minutes of applying direct pressure, apply a tourniquet above the wound to help control the bleeding. A tourniquet is a tight band or cord that is tied around the limb to stop the blood flow. Remember to keep monitoring the person's vital signs, including their breathing and pulse, while treating the bleeding. If the person becomes unconscious or stops breathing, you may need to perform CPR. In summary, severe, life-threatening external bleeding requires quick and effective action to control the bleeding and prevent further injury or harm. Applying direct pressure to the wounded area and using a tourniquet if necessary are critical steps to take in these situations. Welcome to this section on shock. In this training, we will discuss what shock is and how to recognize and treat it. Shock is a life-threatening condition that occurs when the body's organs and tissues do not receive enough blood and oxygen to function properly. It can be caused by a wide range of injuries, including severe bleeding, burns, or trauma. The signs and symptoms of shock may include pale or clammy skin, rapid or shallow breathing, a weak or rapid pulse, and confusion or disorientation. The person may also feel faint, dizzy, or lightheaded. If you suspect that someone is in shock, it is essential to act quickly. The first step is to call for emergency medical assistance. While you are waiting for help to arrive, there are a few things that you can do to help the person. The first thing is to lay the person down on their back with their feet elevated, unless they have a neck, head, or spine injury. This can help improve blood flow to the vital organs. Loosen any tight clothing or belts and keep the person warm with a blanket or jacket. In summary, shock is a life-threatening condition that requires immediate medical attention. Recognizing the signs and symptoms of shock and taking quick action can help improve the person's chances of recovery. Remember to call for emergency medical assistance, lay the person down with their feet elevated, loosen tight clothing, and keep them warm. Welcome to this section on minor wounds. In this training, we will discuss what constitutes a minor wound, how to clean and dress wounds, and when to seek medical attention. A minor wound is a cut, scrape, or puncture that does not require immediate medical attention. These wounds can be caused by accidents, falls, or even from the friction of clothing or shoes. While minor wounds are not life-threatening, it is important to treat them properly to prevent infection and promote healing. The first step in treating a minor wound is to clean it thoroughly with soap and warm water. If the wound is bleeding, apply gentle pressure with a clean cloth or gauze pad until the bleeding stops. Avoid using hydrogen peroxide or rubbing alcohol, as these can damage the surrounding tissue and delay healing. After cleaning the wound, apply an antibiotic ointment and cover it with a sterile adhesive bandage or dressing. Change the bandage daily, or more frequently if it becomes wet or dirty. If the wound is deep, wide, or located on the face, hands, or feet, it may require medical attention. Additionally, if there are signs of infection such as redness, swelling, or pus, seek medical attention immediately. In summary, treating a minor wound involves cleaning the wound, applying an antibiotic ointment, and covering it with a sterile adhesive bandage or dressing. If the wound is deep, wide, or located on the face, hands, or feet, or shows signs of infection, seek medical attention. Welcome to this section on tooth injuries. In this training, we will discuss how to handle various types of tooth injuries, including knocked-out teeth, fractured teeth, and dislodged teeth. Tooth injuries can occur due to accidents, sports activities, or falls. It is important to provide immediate care to increase the chances of saving the tooth and preventing further complications. Let's start with a knocked-out tooth. If a tooth is completely knocked out, follow these steps. First, handle the tooth by the crown, avoiding touching the root. If the tooth is dirty, rinse it gently with clean water, but do not scrub or remove any attached tissues. Try to reinsert the tooth back into its socket, making sure it is facing the right way. If reinsertion is not possible, place the tooth in a container with milk or the person's saliva and seek dental care immediately. Next, let's discuss fractured teeth. If a tooth is broken or chipped, rinse the mouth with warm water to clean the area. Apply a cold compress or ice pack on the outside of the mouth to reduce swelling. It is important to see a dentist as soon as possible for further evaluation and treatment. Lastly, let's cover dislodged teeth. If a tooth is partially pushed out of its socket, gently try to reposition it with light finger pressure. Bite down gently on a soft cloth or gauze pad to keep the tooth in place. Seek immediate dental care for proper treatment. Remember, in all tooth injury cases, it is crucial to seek dental care as soon as possible. The dentist will assess the injury, provide appropriate treatment, and determine the best course of action to save the tooth. Welcome to this section on bleeding from the nose. In this training, we will discuss how to manage and provide first aid for nosebleeds. Nosebleeds, also known as epistaxis, can happen due to various reasons, such as dry air, nasal injuries, or high blood pressure. Although they can be alarming, most nosebleeds are not life-threatening and can be managed with proper care. First, for nosebleeds, have the person sit up straight and lean slightly forward. This prevents blood from flowing down the throat and reduces the risk of choking or swallowing blood. Using their thumb and index finger, they should firmly pinch the soft part of their nose, just below the bony bridge. They should maintain this pressure for about 10 to 15 minutes continuously. Encourage the person to breathe through the mouth. The person should avoid blowing their nose, as this may disrupt the clotting process and prolong the bleeding. Applying a cold compress or ice pack wrapped in a cloth to the bridge of the nose can help constrict blood vessels and reduce bleeding. After the bleeding stops, they should avoid any activities that may irritate the nose, such as forcefully blowing the nose or picking at it. If the bleeding does not stop after 20 minutes of continuous pressure, or if the nosebleed is the result of a significant injury or accompanied by other concerning symptoms, it is advisable to seek medical assistance. Remember, if the person is experiencing frequent or prolonged nosebleeds, or if they have a bleeding disorder or take blood-thinning medications, they should consult a healthcare professional for further evaluation and guidance. Welcome to this section on impaled objects. In this training, we will discuss how to provide first aid when someone has an object impaled in their body. Encountering a situation where an object is impaled in someone's body can be distressing. However, it is crucial to stay calm and follow proper first aid steps to minimize further injury and assist the person until medical help arrives. Let's review the steps to follow for impaled objects. First, ensure your safety and the safety of others before approaching the injured person. Look for any potential hazards, such as sharp objects or unstable structures, that could cause harm. Next, it is essential not to remove the impaled object. Removing it may worsen the bleeding or cause additional internal damage. Instead, leave the object in place and stabilize it to prevent movement. Now that the object is stable, apply gentle pressure around the object using sterile dressings or clean cloth to control any bleeding. Avoid pressing directly on the impaled object itself, as it may cause more harm. If necessary, apply additional dressings around the object, gradually building up pressure to control the bleeding. Make sure to dial emergency services or ask someone nearby to call for help. Provide them with clear and concise information about the situation, including the impaled object and the location of the injury. Continue monitoring vital signs throughout the process. Remember, it is essential to prioritize the person's safety and wait for professional medical assistance in cases of impaled objects. Only healthcare professionals with the necessary equipment and expertise should handle the removal of impaled objects. Welcome to this section on eye injuries involving impaled objects. In this training, we will discuss how to provide immediate first aid for eye injuries caused by impaled objects. Eye injuries can be serious and require prompt and careful attention. If someone has an impaled object in their eye, it is crucial to take immediate action while ensuring your safety and the safety of the injured person. Here are the steps to follow when dealing with eye injuries involving impaled objects. Before approaching the injured person, make sure you are safe and the area is secure. It is important not to remove the impaled object from the eye. Removing it can cause further damage or worsen the injury. The object acts as a barrier and helps stabilize the eye. If the object is still in motion, instruct the injured person to keep their eye as still as possible. Provide them with support to prevent any additional movement of the impaled object. Next, if the injured person has an object impaled in one eye, ensure that they do not touch or rub the unaffected eye. Additionally, dial emergency services or ask someone nearby to call for help immediately. Provide them with clear and concise information about the impaled object in the eye and the location of the injury. Be sure to offer words of reassurance to help keep the injured person calm and cooperative. Let them know that medical help is on the way and that they are not alone. Remember, eye injuries involving impaled objects require immediate medical attention. Do not attempt to remove the object yourself. Leave the assessment and removal to healthcare professionals. Welcome to this section on amputation. In this training, we will discuss how to provide immediate first aid for amputations, which involve the partial or complete loss of a body part. Encountering an amputation can be a traumatic experience, but it is crucial to stay calm and take immediate action to assist the injured person while waiting for medical help. Before approaching the injured person, ensure that it is safe to do so. Dial emergency services immediately or ask someone nearby to call for help. If there is severe bleeding, apply direct pressure to the wound using a clean cloth or sterile dressing. Use your hands or a clean towel to apply firm pressure and help stop the bleeding. If possible, elevate the injured area above the heart to minimize blood flow. Next, consider using a tourniquet only in situations where severe, life-threatening bleeding cannot be controlled by direct pressure alone. A tourniquet may be necessary when direct pressure fails to stop the bleeding or if there is a risk of imminent death. If a tourniquet is necessary, locate a suitable limb site above the amputation or injury site. Place the tourniquet around the limb, approximately 2 inches above the injury site. Tighten the tourniquet until the bleeding stops. Secure it in place and note the time of application. If the amputated body part is present, handle it with care. If it is dirty, gently rinse it with clean water. Place the amputated part in a clean plastic bag or a sealed container. Place that container in another container filled with ice or cold water to preserve it, but avoid direct contact with ice to prevent freezing. Stay with the injured person and monitor their condition closely. Remember, the use of a tourniquet should be a last resort and only applied in situations where severe, life-threatening bleeding cannot be controlled by direct pressure alone. Welcome to this section on internal bleeding. In this training, we will discuss how to recognize and provide immediate first aid for internal bleeding, which occurs when blood leaks from blood vessels inside the body. Internal bleeding can be a life-threatening condition, and it's crucial to act quickly and appropriately to assist the injured person until medical help arrives. Internal bleeding may not be immediately visible, so it's important to be aware of the signs. Look for symptoms such as bruising, pain, tenderness, dizziness, weakness, rapid breathing, or a rapidly worsening condition. Dial emergency services immediately or ask someone nearby to call for help. Clearly describe the situation and provide the location of the injured person. Assist the person in lying down on their back, with their legs elevated if possible. This helps reduce blood flow to the affected area and minimizes the risk of shock. Encourage the injured person to remain calm and still, as movement can worsen internal bleeding. Reassure them that medical help is on the way. It's important not to give anything to eat or drink to the injured person. This precaution is in case they require surgery to treat the internal bleeding. Observe the injured person's vital signs, including their breathing and pulse. Remember, internal bleeding is a medical emergency, and immediate professional medical care is necessary to diagnose and treat the underlying cause. Welcome to this section on open chest wounds. In this training, we will discuss how to provide immediate first aid for open chest wounds, which are serious injuries that expose the internal structures of the chest. Before approaching the injured person, ensure that it is safe to do so. Dial emergency services immediately or ask someone nearby to call for help. Help the injured person lie down on their back, if possible, to ease their breathing. Support their head and neck with a rolled-up towel or clothing to maintain an open airway. Next, use a sterile dressing or clean cloth to cover the open chest wound. Apply firm pressure with your hands to control any bleeding. If available, use a gloved hand to gently hold the dressing in place. Now that the dressing is in place, encourage shallow breathing. Instruct the injured person to take shallow breaths to minimize the movement of air through the chest. This can help prevent further complications. Monitor vital signs. Keep a close eye on the injured person's vital signs, such as their breathing and pulse. Be prepared to perform CPR if necessary. Remember, open chest wounds require immediate medical attention, as they can be life-threatening. Welcome to this section on open abdominal injuries. In this training, we will discuss how to provide immediate first aid for open abdominal injuries, which are serious injuries that expose the internal structures of the abdomen. Encountering an open abdominal injury can be alarming, but it's crucial to stay calm and act quickly to assist the injured person until medical help arrives. As with open chest wounds, you will ensure your safety, call for emergency medical assistance, and protect the injured person. Next, cover the wound. Use a sterile dressing or clean cloth to cover the open abdominal wound. Apply gentle pressure with your hands to control any bleeding. If available, use a gloved hand to hold the dressing in place. It is important not to try to push any organs or protruding tissues back into the abdomen. Doing so can cause further damage and complications. Keep a close eye on the injured person's vital signs, such as their breathing and pulse. Your role in first aid is to provide initial care and support while waiting for professional medical help. Welcome to this section on head, neck, or spinal injuries. In this training, we will discuss how to provide immediate first aid for these types of injuries, which can be serious and potentially life-threatening. Encountering a neck, head, or spinal injury requires quick and appropriate action to minimize further damage and protect the injured person's well-being. As always, ensure your safety and call for emergency assistance. If the injured person is conscious, instruct them to remain still and avoid any unnecessary movement. Support their head and neck by placing your hands on both sides of their head, without applying pressure to the injured areas. If you suspect a spinal injury, do not move the injured person unless there is an immediate danger. Use your hands to support the head and neck in a neutral, aligned position. If necessary, ask someone to bring a rolled-up towel or clothing to place on either side of the neck for additional support. If there is any bleeding from the head or neck, apply gentle pressure with a clean cloth or sterile dressing. Avoid putting direct pressure on the injured area if there is a possibility of a skull fracture. And don't forget to monitor those vital signs. Remember, head, neck, and spinal injuries can have serious consequences, and proper medical evaluation and care are crucial. Welcome to this section on concussions. In this training, we will discuss how to recognize and provide immediate first aid for concussions, which are mild traumatic brain injuries that can occur after a blow to the head or a violent shaking of the head and body. Concussions can have serious implications for a person's health and well-being, and it's crucial to respond appropriately to assist the injured person. Here are the steps to follow when dealing with a suspected concussion. If you witness an incident that may have caused a head injury, such as a fall or a blow to the head, carefully approach the person and ensure the area is safe. Look for common signs of a concussion, which may include confusion, dizziness, headache, memory problems, nausea, sensitivity to light or noise, or changes in behavior or mood. First, if the injury occurred in a hazardous environment, such as a sports field, help the person move to a safe location away from any ongoing risks. Now that it is safe, advise the person to rest and avoid any strenuous physical or mental activities. Reassure them that their symptoms are common after a head injury and that they need time to recover. Keep a close eye on the injured person and observe any changes in their symptoms or behavior. If their condition worsens, if they lose consciousness, or if they experience seizures, call emergency medical assistance immediately. Advise seeking medical evaluation. Encourage the injured person to seek medical evaluation, even if their symptoms seem mild. A healthcare professional can provide a proper diagnosis and guide them through the recovery process. Remember, concussions are serious injuries, and it's essential to take them seriously. Encourage the injured person to prioritize their recovery, follow medical advice, and avoid activities that may worsen their symptoms. Welcome to this section on bone, joint, and muscle injuries. In this training, we will discuss how to recognize and provide immediate first aid for these types of injuries, which can occur due to accidents, falls, or strenuous activities. Bone, joint, and muscle injuries can be painful and may require proper care to promote healing and prevent further damage. First, ensure safety. Then, gently examine the injured area, looking for signs of deformity, swelling, bruising, or an open wound. Ask the injured person about the level of pain they are experiencing. Next, if a bone, joint, or muscle injury is suspected, it's essential to support and immobilize the affected area to minimize movement and further injury. You can use splints, slings, or improvised materials like towels or clothing to provide support. If there is swelling or pain, apply a cold compress to the injured area. This can help reduce swelling and provide some pain relief. Remember to wrap the cold pack or ice in a cloth to avoid direct contact with the skin. If possible, elevate the injured area above the level of the heart. This can help reduce swelling and minimize pain. Depending on the severity of the injury, it may be necessary to seek medical assistance. If the injury involves a suspected fracture, dislocation, severe swelling, or extreme pain, call for emergency medical services or take the injured person to the nearest healthcare facility. Remember, proper medical evaluation and treatment are crucial for bone, joint, and muscle injuries. First aid aims to provide initial support and stabilize the injured person until professional medical help arrives. Welcome to this section on burns. In this training, we will discuss how to recognize and provide immediate first aid for different types of burns, which can result from heat, chemicals, electricity, or radiation. Burns can vary in severity, and it's crucial to respond quickly and appropriately to minimize further damage and provide relief to the injured person. First, ensure that the source of the burn has been removed and there are no ongoing hazards or dangers. Then assess the burn. Determine the severity of the burn. Burns are typically categorized as first degree, superficial, second degree, partial thickness, or third degree, full thickness, based on the depth and extent of tissue damage. Next, cool the burn. For first degree and minor second degree burns, immediately cool the burned area with cool running water for at least 10 minutes. This helps to reduce pain and minimize further damage. Do not use ice or very cold water. If there are no signs of severe tissue damage and it is safe to do so, gently remove any jewelry, clothing, or other restrictive items from the burned area before swelling occurs. Once the burn has been cooled, cover it with a clean, non-stick dressing or sterile cloth. This helps to protect the burn from infection and further damage. Depending on the severity and extent of the burn, it may be necessary to seek medical assistance. For second-degree burns larger than a small area or third-degree burns, call for emergency medical services or take the injured person to the nearest healthcare facility. Remember, burns can be painful and may require professional medical evaluation and treatment. Welcome to this section on altered mental status. In this training, we will discuss how to recognize and provide immediate first aid for individuals experiencing changes in mental status, such as confusion, disorientation, or loss of consciousness. Altered mental status can be caused by various factors, including medical conditions, head injuries, drug overdose, or severe infections. It is crucial to respond promptly and appropriately to ensure the person's safety and well-being. First, ensure your safety and assess the situation. Observe the person's behavior and appearance. Are they responsive? Are they displaying signs of confusion, disorientation, or agitation? Determine if there are any immediate life-threatening conditions that could cause a severe injury. If the person's condition is severe or if you suspect a medical emergency, call for emergency medical assistance immediately. Provide clear information about the person's altered mental state and any other relevant details. Approach the person calmly and speak in a soothing and reassuring tone. Let them know you are there to help and that medical assistance is on the way. If the person is having difficulty breathing, carefully position them on their side in the recovery position. This helps prevent choking and allows fluids to drain from the mouth. Keep a close eye on the person. Remember, altered mental status can indicate a serious underlying condition, and professional medical evaluation is essential. Welcome to this section on poisoning. In this training, we will discuss how to recognize and provide immediate first aid for individuals who have been poisoned or have ingested harmful substances. Poisoning can occur through various means, including ingestion, inhalation, or contact with toxic substances. It's crucial to act quickly to prevent further absorption of the poison and seek appropriate medical help. Before approaching the person, ensure that it is safe to do so. Take precautions to protect yourself from exposure to the poisonous substance. If necessary, wear gloves or use a barrier like clothing or a towel to avoid direct contact. Observe any signs or symptoms of poisoning. These may include nausea, vomiting, difficulty breathing, dizziness, seizures, or altered mental status. Ask the person about what they ingested or were exposed to, if possible. If the person is experiencing severe symptoms, such as difficulty breathing, loss of consciousness, or seizures, call emergency medical assistance immediately. Provide clear information about the suspected poisoning and any relevant details. If it is safe to do so, move the person away from the toxic substance or contaminated area. This helps prevent further exposure. Do not induce vomiting. In most cases of poisoning, it is not recommended to induce vomiting unless specifically instructed by a healthcare professional or poison control center. Inducing vomiting can sometimes worsen the situation, especially if corrosive substances have been ingested. If possible, keep any containers, plants, or substances that may have caused the poisoning. This can help medical professionals identify the poison and provide appropriate treatment. Remember, poisoning can be life-threatening, and professional medical evaluation and treatment are essential. Your role in first aid is to provide initial support, prevent further exposure, and ensure the person's safety while waiting for medical help. Welcome to this section on asthma. In this training, we will discuss how to recognize and provide immediate first aid for individuals experiencing an asthma attack. Asthma is a chronic respiratory condition characterized by the inflammation and narrowing of the airways, leading to difficulty breathing. Asthma attacks can be triggered by various factors, such as allergies, exercise, or exposure to irritants. It's important to act quickly to help the person during an asthma episode. How to recognize the signs of an asthma attack. Look for symptoms such as wheezing, coughing, shortness of breath, chest tightness, and difficulty speaking. The person may also appear anxious or distressed. During an asthma attack, encourage the person to sit upright in a comfortable position. This can help open up their airways and make breathing easier. If the person has their own prescribed inhaler, assist them in using it. Ask if they have a specific technique for using their inhaler and follow their instructions. Most inhalers require the person to take a deep breath, exhale fully, and then inhale the medication as directed. Stay with the person and provide reassurance. Encourage them to take slow, deep breaths and try to stay calm. Anxiety can worsen asthma symptoms, so your calm presence can be comforting. Keep a close eye on the person's breathing and overall condition. If their symptoms worsen, they become unresponsive, or their lips or face turn blue, it may indicate a severe asthma attack or respiratory distress. In such cases, call for emergency medical assistance immediately. One way to help the person is to avoid any known triggers that may worsen their asthma symptoms, such as smoke, strong odors, or allergens. Remember, asthma attacks can vary in severity, and it's crucial to seek professional medical help if the person's condition worsens or does not improve with their prescribed medication. Relief of choking. In this training, we will discuss how to recognize and provide immediate first aid for individuals who are choking and unable to breathe. Choking occurs when an object or a piece of food becomes lodged in the airway, blocking the flow of air. Acting quickly and correctly is crucial to clear the obstruction and restore normal breathing. First, assess the situation. Determine if the person is indeed choking by observing their behavior. Common signs of choking include clutching the throat, difficulty speaking or breathing, and a panicked or distressed expression. Next, encourage them to cough. If the person is conscious and able to cough, encourage them to cough forcefully. Coughing can help dislodge the obstruction from the airway. If coughing did not work, perform abdominal thrusts, also known as the Heimlich maneuver. To perform the Heimlich, stand behind the person, place one foot slightly forward, and wrap your arms around their waist. Make a fist with one hand and place it just above the navel, grasping it with your other hand. Give upward and inward thrusts to the abdomen in a quick and forceful manner, aiming to dislodge the object. Repeat this procedure until the obstruction is cleared or the person becomes unconscious. If the person becomes unconscious, lower them gently to the ground and immediately call for help and begin CPR. Check the mouth for any visible obstructions before giving a rescue breath. Remember, time is critical when someone is choking. Prompt action can be life-saving. Severe allergic reactions. In this training, we will discuss how to recognize and provide immediate first aid for individuals experiencing a severe allergic reaction, also known as anaphylaxis. Severe allergic reactions can occur in response to allergens such as certain foods, insect stings, medications, or latex. These reactions can rapidly progress and become life-threatening. Let's review how to recognize the signs of anaphylaxis. Look for symptoms that indicate a severe allergic reaction, including difficulty breathing, wheezing, swelling of the face or throat, hives or skin rash, rapid heartbeat, dizziness, or loss of consciousness. The person may also express a sense of impending doom or extreme anxiety. If you suspect a severe allergic reaction or if the person has a known history of anaphylaxis, call emergency medical assistance immediately. Provide clear information about the person's condition and any known allergies or triggers. If the person has an epinephrine auto-injector, such as an EpiPen, assist them in using it. Instruct them to remove the safety cap, firmly place the injector against their outer thigh, and push the injector firmly until it clicks. Encourage them to hold it in place for a few seconds before removing it. Some individuals may require a second dose of epinephrine if their symptoms do not improve or worsen after the initial injection. Help administer the second dose. Next, we will encourage the person to sit or lie down in a comfortable position. Monitor their vital signs, and offer comfort and reassurance to the person. Remember, anaphylaxis is a severe and potentially life-threatening condition. Immediate medical attention is essential. In this training, we will discuss how to recognize the signs and provide immediate first aid for individuals experiencing a heart attack. A heart attack, also known as a myocardial infarction, occurs when blood flow to a part of the heart muscle is blocked, typically due to a clot in the coronary arteries. Acting quickly and correctly can help minimize damage to the heart and improve the person's chances of survival. The first step is to recognize the signs of a heart attack. Look for symptoms such as chest discomfort or pain that may feel like pressure, squeezing, or heaviness. The pain may radiate to the arms, jaw, neck, back, or stomach. Other symptoms may include shortness of breath, cold sweats, nausea, lightheadedness, or a sense of impending doom. If you suspect a heart attack, call emergency medical assistance immediately. After calling, assist the person in finding a comfortable position, preferably in a seated position if they are able to tolerate it. Loosen any tight clothing to ease breathing. If the person is conscious and not allergic to aspirin, help them chew and swallow a regular, uncoated aspirin tablet. Aspirin can help prevent further clotting and reduce the damage caused by a heart attack. Stay with the person and monitor their vital signs, and offer reassurance and support. Your role in first aid is to recognize the signs, call for emergency medical assistance, help the person rest, and administer aspirin if appropriate. Welcome to this section on strokes. In this training, we will discuss how to recognize the signs and provide immediate first aid for individuals experiencing a stroke. A stroke occurs when the blood supply to the brain is interrupted or reduced, depriving the brain of oxygen and nutrients. Acting quickly and correctly can help minimize brain damage and improve the person's chances of recovery. Recognize the signs of a stroke. Remember the acronym FAST, which stands for face, arms, speech, time. Look for the following signs. Face, ask the person to smile. Is one side of their face drooping? Arms, ask the person to raise both arms. Does one arm drift downward? Speech, ask the person to repeat a simple phrase. Is their speech slurred or strange? Time, if you observe any of these signs, it's time to call emergency medical assistance immediately. Call for emergency medical assistance. If you suspect a stroke, call emergency medical assistance right away. Now that help is on its way, assist the person in finding a comfortable position, preferably lying down with their head slightly elevated. Loosen any tight clothing to aid in breathing. It's important to avoid giving the person anything to eat or drink as they may have difficulty swallowing due to the stroke. Stay with the person, monitor their vital signs, and offer reassurance and support. Remember, time is critical during a stroke. Immediate medical attention is crucial to prevent further damage and improve outcomes. Your role in first aid is to recognize the signs, call for emergency medical assistance, help the person rest, and offer reassurance. Welcome to this section on seizures. In this training, we will discuss how to recognize the signs and provide immediate first aid for individuals experiencing a seizure. A seizure is a sudden, uncontrolled electrical disturbance in the brain that can cause changes in behavior, movements, and consciousness. It's important to stay calm and ensure the person's safety during a seizure episode. Here are the steps to follow when dealing with a seizure. Ensure safety. If possible, create a safe space for the person by clearing away any objects that could pose a risk of injury. Cushion their head or remove nearby hazards. Next, do not restrain the person. During a seizure, it's essential not to restrain the person or try to stop their movements. Allow the seizure to run its course. Protect the person's head. If the person is on the ground or in a position where their head could hit a hard surface, place something soft like a folded jacket or pillow under their head to protect it. Note the time the seizure begins and observe the person's movements and behavior. This information will be helpful for medical professionals. Remain with the person until the seizure ends and they are fully alert. Offer reassurance and support. Ensure an open airway. Check that the person's airway is clear and unobstructed. If necessary, gently turn them onto their side to prevent choking and allow saliva or vomit to drain from their mouth. Do not put anything in their mouth. Contrary to popular belief, it is not necessary or safe to put anything in a person's mouth during a seizure. They will not swallow their tongue, and placing objects in their mouth can cause injury. If the seizure lasts longer than 5 minutes, the person has repeated seizures without regaining consciousness, or if it's their first seizure, call emergency medical assistance. Remember, seizures can be frightening to witness, but they are usually not life-threatening. By ensuring safety and offering support, you can help the person through the seizure episode. Welcome to this section on diabetes and hypoglycemia. In this training, we will discuss how to recognize the signs and provide immediate first aid for individuals experiencing low blood sugar levels, also known as hypoglycemia, due to diabetes. Diabetes is a chronic condition in which the body has difficulty regulating blood sugar levels. Hypoglycemia occurs when blood sugar levels drop too low, which can be dangerous if not addressed promptly. Be aware of the symptoms of high blood sugar, hyperglycemia, and low blood sugar, hypoglycemia. High blood sugar symptoms include frequent urination, excessive thirst, blurred vision, fatigue, and fruity breath odor. Low blood sugar symptoms include confusion, irritability, weakness, trembling, sweating, dizziness, headache, and hunger. If you suspect someone is experiencing a diabetes-related emergency, such as severe hyperglycemia or hypoglycemia, offer your help. Ask if they have diabetes and if they require any immediate assistance. If the person carries diabetes supplies, such as a glucometer, glucose tablets, or insulin, assist them in accessing their supplies. If they are unable to do so themselves, ask if there is a designated person or emergency contact who can assist. If the person is conscious and able to communicate, encourage them to follow their prescribed diabetes management plan. This may include checking their blood sugar levels, administering insulin, or consuming a snack or meal. Diabetes can be a challenging condition to manage, so offering support and reassurance to the person can be beneficial. Let them know that you are there to assist and that medical help is available if needed. If the person's condition worsens, they lose consciousness, or they are unable to manage their diabetes effectively, call emergency medical assistance. Your role in first aid is to recognize the signs, offer assistance, and support the person in following their diabetes management plan. Welcome to this section on heat emergencies. In this training, we will discuss how to recognize the signs and provide immediate first aid for individuals experiencing heat-related illnesses or emergencies. Heat emergencies can occur when the body is exposed to excessive heat and is unable to regulate its temperature properly. These emergencies can range from mild heat cramps to severe heat stroke, which can be life-threatening if not addressed promptly. With heat emergencies, be aware of the different heat-related illnesses, including heat cramps, heat exhaustion, and heat stroke. Look for symptoms such as muscle cramps, excessive sweating, dizziness, nausea, headache, rapid heartbeat, confusion, and loss of consciousness. If someone is experiencing a heat-related illness, help them move to a shaded or air-conditioned area. If possible, bring them indoors or find a cooler spot with adequate ventilation. Have the person rest in a comfortable position and encourage them to drink cool water or a sports drink containing electrolytes. Avoid alcoholic or caffeinated beverages, as these can further dehydrate the body. If the person is conscious and not experiencing signs of heat stroke, use cooling measures to lower their body temperature. Apply cool, wet cloths to their forehead, neck, and armpits. Use a fan or create air circulation to enhance cooling. Stay with the person and monitor their symptoms closely. If their condition improves and they are fully alert, it's a positive sign. If the person is experiencing severe symptoms like confusion, rapid breathing, seizures, or unconsciousness, call emergency medical assistance right away. Heat stroke is a medical emergency that requires immediate professional care. Remember, prevention is crucial when it comes to heat-related emergencies. Stay hydrated, dress appropriately for hot weather, and avoid prolonged exposure to extreme heat. Welcome to this section on cold emergencies. In this training, we will discuss how to recognize the signs and provide immediate first aid for individuals experiencing cold-related illnesses or emergencies. Cold emergencies can occur when the body is exposed to extreme cold temperatures and is unable to maintain its normal body heat. These emergencies can range from mild conditions like frostbite and hypothermia to more severe cases requiring immediate medical attention. It's important to be aware of the different cold-related illnesses, including frostbite and hypothermia. Look for symptoms such as numbness, tingling or pain in the extremities, pale or waxy skin, shivering, confusion, drowsiness, and weak pulse. If someone is experiencing a cold-related emergency, help them move to a warmer environment as soon as possible. If indoors, turn up the heat or use blankets to provide warmth. If outdoors, seek shelter or use a blanket or emergency blanket to protect them from the cold. Remember, if the person's clothes are wet, remove them and replace them with dry clothing or blankets. Wet clothing can further contribute to heat loss and increase the risk of hypothermia. It's vital we warm the person gradually. If the person is conscious and able to consume warm beverages, provide them with warm fluids such as hot water or tea. Avoid using hot water bottles or heating pads, as they can cause burns. Use your body heat or warm blankets to assist in warming the person. Stay with the person and monitor their symptoms closely. If their condition improves and they regain normal body heat, it's a positive sign. If the person is experiencing severe symptoms like loss of consciousness, severe confusion, or a weak pulse, call emergency medical assistance right away. Prevention is crucial when it comes to cold-related emergencies. Dress warmly in layers, cover exposed skin, and avoid prolonged exposure to extreme cold temperatures. Welcome to this section on bites and stings. In this training, we will discuss how to recognize common bites and stings and provide immediate first aid to individuals who have been bitten or stung by insects, animals, or snakes. Bites and stings can occur in various settings, such as outdoor activities or encounters with animals or insects. It's important to know how to respond quickly and effectively to minimize the risk of complications. Before we help, we need to ensure your safety and the safety of others before approaching the person who has been bitten or stung. If the source of the bite or sting is still present, move away from it to prevent further injuries. Determine if the person has been bitten or stung by an insect, animal, or snake. Knowing the type of bite or sting can help guide your first aid response. If the person has been stung by an insect with a stinger, such as a bee or wasp, use a blunt object, like a credit card or your fingernail, to gently scrape the stinger out. Do not use tweezers or squeeze the stinger, as it may release more venom. Next, we will clean the affected area. Use mild soap and water to gently clean the bite or sting site. This helps reduce the risk of infection. After the area is clean, use a cold compress or ice pack wrapped in a cloth and apply it to the affected area. This can help reduce pain and swelling. If the person is experiencing pain, you can provide over-the-counter pain relievers like acetaminophen or ibuprofen, following the recommended dosage instructions. Lastly, monitor for signs of an allergic reaction and advise seeking medical attention. Watch for signs of an allergic reaction, such as difficulty breathing, swelling of the face or throat, hives, or dizziness. If the person shows any of these signs, call emergency medical assistance immediately. Some bites and stings can be more dangerous than others, especially if the person has a known allergy or if the bite comes from a venomous animal or snake. If in doubt, it's always best to seek medical help. Congratulations! You have completed this comprehensive first aid training, covering a wide range of emergency situations. By learning and practicing the skills presented in this training, you are now better equipped to provide immediate care and assistance when it matters most. By completing this training, you have become a valuable asset to your community. Your newfound knowledge and skills in first aid can make a significant difference in someone's life during an emergency. Remember, the information and techniques covered in this training are meant to serve as guidelines. Always prioritize your safety and the safety of others when providing first aid. If you are unsure about any situation or if it seems beyond your capabilities, seek professional medical assistance immediately. Thank you for your dedication and commitment to learning first aid. Continue to review and practice these skills regularly to maintain your proficiency. Together, we can create a safer and more prepared community. Now that you've finished this portion of training, please schedule your skill assessment to finish becoming certified.